I've got a few slides to introduce both the seminar series and Tracy, and so we'll start this up. So this is the inaugural seminar for a School of Cities seminar series on building resilience in food and health supply chains. And we have 5 project leads from across all 3 campuses of the University of Toronto, from geography, from public health, from anthropology, and from mechanical and industrial engineering. And I'd like to thank the School of Cities, and in particular, Professor Mark Fox, for making this possible. It was sort of his idea to get this going, and he handed it over to us to try to make it happen. And so if you're wondering about the series and this very wide-ranging group of organizers, it's really part of our goal from the beginning to have a very interdisciplinary discussion about supply chain and about resilience in the supply chain. I come up from an engineering perspective, and so supply chain means something fairly specific, and as I'm learning and talking to my collaborators, fellow project leads, that there's a much wider perspective from a number of different areas in the social sciences, from in healthcare and in engineering on what supply chains are and what resilience means. And so our goal is to be very open-minded about supply chains and about resilience, and to try to understand what the different perspectives that both the organizers as well as our speakers are bringing to this. And really our goal at the end of this series is to come up with a series of research challenges that stretch across the boundaries to understand what supply chain and what resilience within supply chains actually means. So that's the goal, and I encourage you to be open-minded about what we're talking about, and to try to stretch and understand the different speakers' perspectives on things. Don't be afraid to ask stupid questions, because as I'm understanding, we all have huge gaps in our areas when we're sitting down and talking to each other. And so I'm really looking forward to this as a learning experience, and I hope you'll embrace that as well. We've got a number of seminars already lined up, so we're taking a break for Thanksgiving for next week, but then after that, we've got 4 in a row lined up, both from the project leads, and starting on November 2nd, we're going to be going beyond U of T. There's right now a hole between November 9th and December 7th that we're hoping to fill in, and then we're going to, in the new year, we're going to fill in with some more talks. And so these are all building and will be coming. And so then, without further ado, I will introduce our speaker for today. And so Professor Tracey Galloway is a professor at the University of Toronto, Mississauga. She's a biological anthropologist and community health scholar. Her research aims to reduce the burden of chronic disease amongst Indigenous people living in northern communities by removing existing barriers to health and to food security. Tracy works alongside Indigenous leaders, elders, and other allies on projects to improve access to health services and affordable food in northern communities. Tracy's partnerships extend across the circumpolar north, and she's recognized globally as an expert on health in circumpolar Indigenous populations. She's an active member of the International Union for Circumpolar Health, and has worked extensively with scholars from the Alaska Native Tribal Health Consortium, the Greenland Institute for Public Health, and the Danish National Institute for Public Health. Her work is valued for its commitment to decolonizing principles and its support for Indigenous governance. Now, you may be wondering what all this has to do with supply chain, but in fact, Tracy's research has been one of the main motivators for a lot of what this seminar series is talking about. As an emerging focus is the central role played by transportation within northern communities. She's exploring the connection between transportation infrastructure, services, and policy, and the delivery of essential services. Tracy examines how food cost, food sovereignty, and food subsidy policy are shaped by the transportation infrastructure and governance, and how these processes are in turn vulnerable to extreme weather and climate change. And so I could think of no better person to kick off our seminar series to talk about the work that she's done and is continuing to do. And so with that, I will stop sharing and turn it over to Tracy.
All right, thank you very much, Dr. Beck. You can hear me all right, Chris?
Yes.
Okay, wonderful. I'll just get my slides going here. All right. As Chris says, we're coming at this from a very interdisciplinary approach. So I don't feel like I often feel, kind of at the fringes as an anthropologist. I feel like such a holistic discipline can sit right at the center of an inquiry such as this one. So I'm really pleased that the School of Cities is supporting this seminar series. And my talk today will be on mainly on food security in northern communities in Canada and how that is conceived, understood, and impacted by transportation, infrastructure, and services. And I think that I'll make the case that that relates to supply chains, because in the north, transportation is a conduit for all sorts of service delivery: food, health, birthing services, social services, economic development, education, and employment. And so I really think that the pathways through which people and goods flow are integral to community well-being, community sustainability, and community economic development. So today what I'd like to do, I'll try not to take too long in case you have any questions or want to discuss some of these matters. I'd like to just talk a little bit about how we define remote communities, what the food security prevalence looks like in those communities, and what some of the health impacts are. And then how we understand food security and retail from the perspective of infrastructure and services. So what are the limitations on food security in northern communities? And then what are some of the additional policy challenges that are relevant to food security in these places? So, but I thought what I'd do, I'm always trying to make the case that our vision of remoteness, the way we define and operationalize it, is a little bit romantic and a lot tied to the colonial project. So I just did a Google image search for remote northern, and these are the first two hits that came up. The first is a CBC article entitled "Remote Communities Aren't Diseased." I guess it's a success story of the pandemic. And the second was a Vogue magazine article, "Remote and Wild: A Tour Through Northern Canada," featuring a picture of the Klondike River. And I think both of these images kind of reinforce my thesis, as yet unproved, that we have a very romantic idea of what constitutes the North, and particularly the remote North. But when we operationalize that from a service perspective, we're really looking at links to the South. So we define northern and remote in terms of its relationship to the South. So here is a report of the Auditor General of Canada from 2017 on civil aviation infrastructure. And you can see these are the communities that have what are defined as remote northern airports. There are very few northern airports that are under federal jurisdiction, only those in Whitehorse, Yellowknife, and Iqaluit. The rest are under the jurisdiction of the provinces and territories. In terms of a wider view of transportation infrastructure, this is how remoteness can be defined in Canada by categories of air, combinations of air and winter road or seasonal ferry access. And then you'll see this category that's used by Statistics Canada in its latest publication on how to measure remoteness: communities that are unorganized or have no infrastructure. And some of these are, in fact, communities with significant populations. And then some are mines or gas wells or not places where we would normally think of as communities with a resident year-round population. And you can see that we have many remote communities in Canada that are in fact in the South. So if you use the definition of having a combination of air, winter road, or seasonal ferry access, it includes the communities on Pelee Island and some communities on the west coast of Vancouver Island. Right? The StatsCan definition actually rates as full communities, places that are in fact just mines and mine developments that are wholly owned by for-profit commercial enterprise. So the airstrips and the harboring or port facilities and all the community facilities are actually, these are mine towns, such as the one at Milne Inlet, pardon me. Okay, and then you know, we have other communities that are built around defense or strategic military investment. And so this is the community of Resolute Bay. It has a year-round resident Inuit population, but a large majority of the population work at the Polar Continental Shelf facility or the military facility in this community. And so that it's interesting to think about community services for a community that is developed around a mine or a research facility or a military installation. Those have to be conceived of and carried out very differently than communities that are themselves resident indigenous communities in the north. Okay. And then we can even broaden out the definition of remoteness based on something like fuel use. So there are, if you use the definition of communities being dependent, being off-grid, dependent on diesel power generation for both heating and electricity, then there are a lot of remote communities in Canada, and many, many of them don't fall into the far north service area. Okay. But for my purposes today, I'm going to focus on the northern communities that qualify for a special food subsidy. So these are the 116 communities that are eligible for Nutrition North Canada, which is a retail subsidy designed to make food more affordable and ensure it's consistently available in remote communities. And these are communities that range in population from 200 to 7,000 people. 7,000 is the largest, that's Iqaluit and Nunavut. They are 85% comprised of self-declared Indigenous people using the census. These communities have very young populations if you look at any population profile compared to Canada. So they have much larger percentage of the population below 30 as compared to the general Canadian population that still has that demographic bulge around the age of 50 and 60. That's the baby boom population moving through the demographic curve. Okay. And the northern communities are also undergoing rapid population growth. So they led the census in the 2016 analysis for population increase at 13%. In terms of services, these communities have a very limited range of service providers, and all of their basic primary health services are supported by secondary and tertiary referral to urban centers in the south. So if you use Nunavut as an example, the government of Nunavut runs a community health center in each community that's staffed full-time with nurses and community health workers, but very few of the communities have resident physician staff. I think only 3. And the rest have physician staff that come up on rotation, and all secondary and tertiary care provided at referral hospitals in Yellowknife, Edmonton, Winnipeg, Ottawa, and Montreal. Okay. Public health services for the northern communities are provided by some kind of central health agency or authority. Using the Nunavut example, that's the Nunavut government with offices in three of the communities of the 25. And then those public health services are carried out by community health representatives and workers located in the communities. There are very limited local safety and emergency services, and there's a real complex system of funding and governance for all of this service provision in the north. I'd like to use food security as the lens to examine some of this service provision and its intersection with transportation and supply chains. So I'm just using the USDA definition of food security status for households. And so I put up here a nice articulation of it from Alberta Health Services. And we're really concerned with moderate or severe food insecurity in households. And that's where people are forced to cut back on the amount or the quality of food due to a lack of money, even skip meals, sometimes for an entire day or longer. And I'd just like to share that I do this food security work in collaboration with a number of Indigenous agencies across Canada. And really, I work under their direction, most prominently the Nunavut Food Security Coalition and the National Inuit Food Security Working Group, which is led by Inuit Tepirit Kanatami. But all of the northern regions have mandates to examine food security status in their regions and in their communities, and they do an excellent job of doing that. And so it's my role and privilege to provide data in support of their analyses and their advocacy for policy change. So this year, Dr. Valerie Tarasuk and colleagues at the Proof Agency in the Faculty of Medicine put out some new descriptions of household food insecurity using the 2017-18 cycle of the Canadian Community Health Survey. So you can see, even by that very limited statistics engine, and I say limited because the CCHS doesn't sample outside the 10 largest communities in Nunavut. And that type of sampling frame is fairly prevalent across the north. So the smallest communities, those with the highest food insecurity, are underrepresented in these data. But even with that limitation, you can see that household food insecurity is very, very high in the north, extremely high in all of the territories, the highest in Canada in Nunavut. Okay. And the proportion of children who live in food insecure households is also very high, close to 80% in Nunavut, but 30% in Northwest Territories, and very high in some parts of the Maritimes. And these are often very rural, remote, and predominantly Indigenous communities. And then by Aboriginal identity, it's clear that Indigenous Canadians by far are overrepresented among food insecure households. So First Nations people living off reserve have very high rates of food insecurity, particularly among women. Métis have about twice the rate of food insecurity as the non-Indigenous Canadians, and then Inuit have the highest rate of food insecurity of all. And we know that food insecurity has severe negative impacts on health. This is a recent publication examining mental health outcomes among marginally, moderately, and severely food insecure people. And you can see that the relationship is significant. Okay. And the Proof group in the Faculty of Medicine also have a recent paper out by Men and colleagues looking at the impact of food insecurity on mortality. So for all-cause mortality, we see this stepwise increase in all-cause mortality by category of food insecurity. And if we look at by cause mortality, we see that food insecurity severity is a predictor of chronic diseases such as cancers, cardiovascular and metabolic diseases like diabetes, and infectious diseases. So parasitic diseases. It's also a predictor of injuries, suicide, and avoidable causes of death. So food insecurity has tremendous negative impacts on households that it affects. And that will pertain to a large degree in the north, where food insecurity prevalence is so high. So I'd like to speak for a minute about the context of food insecurity in northern communities. So in terms of the service landscape, food retail is dominated by a small number of southern-owned for-profit companies. The largest of which, the one with the most stores in the north, is the Northwest Company. And the Northwest Company is what it sounds like. It's actually the Hudson's Bay Company and the Northwest Fur Trading Company. They amalgamated over 100 years ago. And since 1980, they've been known as the Northwest Company and operated in the Canadian Arctic. And they have the most stores in the north, and they have stores in almost every province and territory where there is a remote northern community. Okay. And this is a sort of a typical example of what a Northwest company store looks like. So they operate under the brand Northern in many communities, and they're small, they're kind of metal clad. They often sit on the actual physical site of the former Hudson's Bay Company trading post in the communities, and you can still take furs to the store and put them on account and buy your groceries with that money. Okay. This is a newer Northern store in Bearskin Lake, Nunavut. Okay. So while most retail stores in northern communities are owned by a southern retailer, there are a number of locally owned and operated retail stores, quite often operated by the First Nation communities themselves. And this is most common in the northern communities that are in the provincial north. And so these are on reserve First Nations or bands. They're governed as bands under the Indian Act. And this is a typical example of one of those locally owned and operated retail stores. It's KI Family Foods in the community of Kitchener-Makusig and Inuit First Nation in Northern Ontario. The other name for that First Nation is Big Trout Lake, if anybody recognizes that. So these stores operate with heavy reliance on limited transportation services. There are very few ways to get their freight to the stores, to the communities. And the predominant way to do that is to fly it, particularly for perishable foods. That all has to be flown during any month when there isn't a surface option to transport that food. And a surface option would be by sea or by road. So this is an example of a route map. This is Canadian North Airlines, this sort of major airline that serves the high Arctic in Canada. And that is how food is flown to those communities on cargo pallets that are loaded in Edmonton, Winnipeg, or Ottawa, and then flown up to a central base like Yellowknife, Rankin Inlet, or Iqaluit, and then flown on these little circular routes around the communities. And this is a similar route map for Northern Ontario. So this is the route map for Calm Air, and you can see they fly into Northern Manitoba and a little bit into the Kivalliq region of Nunavut. This is the sort of marine option. So there is a limited surface sea transportation for some communities for certain parts of the year. And I put this slide here to just give you the flavor of what that looks like. This is a sea lift ship arriving in Cape Dorset, Nunavut in October of 2019. The shipping season in the high Arctic is very short. It may last from August to October, but because there is a large number of communities to service, often a community, especially a small one like Cape Dorset with its small population, might only see 1 or 2 sea lifts per season. And then on the left here, you can see this is a sea lift schedule. And I think Cape Dorset is listed kind of at the upper left here. It's the third option. And you can see from the text above that if you want to have goods on the ship for Cape Dorset, which may arrive by October of the same year, you need to have that order to their loading facility by May 1st to be shipped out of the warehouse by May 15. That is loaded, palletized, and then integrated into the cargo vessel's whole freight manifest by May 1st for shipment May 15th. The boat won't arrive till October, but that's the kind of schedule you have to work on. So in order to bring non-perishable goods to communities by sea lift, a retailer or a household has to have pretty good credit so that they can carry the value of those goods on their credit card or in their bank for months and months, because it takes a long time to exercise this option. And then, of course, there's a limited winter road season for some parts of the north. This is mainly the provincial north, but a little bit into Yukon and Northwest Territories, Quebec and Labrador. So you can see the road network on the left. That is a combination of hard surface roads, gravel roads, and then temporary ice roads or winter roads that are constructed for short seasons, January, February, maybe lasting into early April, depending on icing conditions. And I just put the Nutrition North community map to the right there so that you can see that most of the communities aren't reached by this winter road network. So the winter roads are a surface option for getting foods to the north for only a limited number of communities. How are we going? Chris, can you still hear me okay?
Yep, everything's going fine from here.
Okay, super. So part of the infrastructure landscape is that the communities have quite variable transportation infrastructure. And some of the reason for that is there has been a wide variety of investment in the north for different purposes. So some communities have quite a bit of legacy or historical transportation infrastructure that dates to their importance as a military installation. And an example of that is Cambridge Bay, Nunavut. It's got an over 5,000 foot paved runway, I believe it's paved, and it has quite an impressive radar installation that can support safe flying to that community. And for that reason, it's one of Nunavut's most populous communities. But this infrastructure really dates from its pivotal role in the distant early warning line during the Cold War and military investment that was made by the US and Canada from that time. And so it continues to be of strategic importance for those reasons, but that means that food retail and health service operation and housing look very different in Cambridge Bay because of the transportation infrastructure the community has. And I just offer in contrast this community I visited last February, right before COVID and the lockdown. It's hard to believe. This is a community in Northern Ontario called Bearskin Lake. And it has I think it's a 3,500 foot runway, much shorter runway that doesn't enable jets or very large aircraft at all to land. It's a gravel strip. It is prone to flooding. It sits very close to the lake system. And it has a 3-kilometer road to town. So people who live in Bearskin Lake have a much different set of transportation options because there was never a strategic or military reason to develop infrastructure in that community. And so its airport only dates from the 1980s. And consequently, you can only land these very small Pilatus aircraft. And even those, the Pilatus, are operating at the limit of their capacity on that short strip. And airlines have to do all sorts of creative things like remove seats to take weight out so the planes can take off. Okay. And that affects the marine infrastructure too. So Cambridge Bay also has a small harbor. It doesn't qualify as a port. There are very few port facilities in the north, as you can see from this federal port facility map. Roberts Bay is the port for a mine, so is Nanisivik. There really are very few community-based ports or harboring facilities in the north. So all those sea lift ships that go to the north have to anchor offshore in the deep water and barge their freight in, and the barges just drive right up on shore and offload goods. And so the goods are very subject to damage because they have to just sit on the ground surface until they can be picked up. So depending on wave action and icing and freezing conditions or rain, the goods can be damaged. So it's only an option for non-perishable foods. So there is a policy designed to support this very challenging retail environment, and it's called the Nutrition North Canada Subsidy. And I spend about 50% of my research effort evaluating this subsidy platform and its impact on communities. So this slide is meant to tell the very short story that there's a subsidy, it fails to keep prices low, and people are ticked about it. And any food security researcher who works in the north carries around a slide like this. All of these images come from the Facebook group Feeding My Family, and that Facebook group was started by Lisi Papatic, who's an advocate and an activist in the north, and she's done an amazing job of raising awareness about high food costs in the north and challenging people who say the subsidy is effective in those communities. Okay. And these are some of my papers about the evaluation, and I won't go into detail on those here. I just added 3 slides that are summaries of those results. So the Nutrition North Canada Subsidy has 2 goals. One is to increase the amount of food shipped to the north, and the other is to keep the costs low. So this slide kind of answers the question, does the subsidy increase the food amount shipped to the north? Food volumes shipped to the north are pretty consistent. This is per capita food volume shipped to the north between 2011 and 2016. They don't change a lot, but what you do notice is that the per capita kilograms are higher in some territories and provinces than they are in others. And they tend to be higher in the provinces and territories where the subsidy rates are higher. So they're very, very high in Nunavut, for example. The purple line is kind of an anomaly. The food volumes you see, they were about average at the beginning. They sunk very low, and now they've gone up. And that the amount of food shipped to that's the Yukon community of Old Crow. So when the dip occurred, Old Crow, actually, the community had their Northwest Company store. They forced it to close, and they built a winter road and opened their own store. And now food shipments have increased. And then that second goal to lower food costs in the communities really only happened during the first 9 months of the subsidy implementation. And that's kind of against a backdrop of a period where there was no subsidy at all. So if we look at it from March 2012 on, food costs are pretty consistent, slightly increasing in some regions. And again, you see these wide disparities. So food costs in the community of Old Crow, Yukon are the highest in Canada. And this is using a food costing tool called the Revised Northern Food Basket that's supposed to describe some parity across northern regions. It estimates food costs for a household of 4, 2 parents and 2 children for 1 week at $500 for Old Crow. And you can see that, again, there are some provinces and territories that have food costs much higher than average for the program, and some that have lower. And then there are these very anomalous communities, like this community, Norman Wells in Northwest Territories, where you see food costs just rise exponentially over the subsidy period. And my main sort of complaint about the Nutrition North Canada food subsidy is that all of these anomalies are allowed to happen. There's nothing in the policy to prevent them. So I teamed up with Val Tarasuk and her brilliant PhD student, André-Anne Fafard Saint-Germain, for a look using a very elegant methodology called interrupted time series analysis. That was André-Anne's brilliant contribution. And she looked at food insecurity rates before, during, and after the launch of this retail subsidy program. And rather than improving people's food security status, food insecurity rose after the implementation of the program. So that's concerning. So what I've been trying to do over the last couple of years is work with this interdisciplinary group of colleagues to try and examine the context of food insecurity in northern communities. What is it about food insecurity in these places that is so connected to transportation, infrastructure, and services, and to other domains of life? So our earliest entree into that work was this spatial analysis led by Michael Widener, and Shoshana Sachs in the Department of Civil Engineering was a contributor to this. And we looked at just what factors in communities had an impact on whether or not planes arrived on schedule. And of course, runway length is one factor. And when we tried to see if transportation infrastructure framed as runway length had an impact on food cost, we found it had no relationship. So clearly, the relationship between community infrastructure and food security is a complex one. Doesn't mean these things aren't a part of the story, but I think we need to examine more closely to find out how they work together. Well, what we have learned over the past few years is that there's a concentration of services in the north. So in the retail sector, there are very few stores operating in these communities. And in fact, 23% of communities don't have a subsidy eligible store at all. They may have a local store or a southern-based store, but it is not receiving any fiscal support from the federal subsidy. 70% of the northern communities that are eligible for subsidy have only one store, and overwhelmingly it is a Northwest Company store. Okay? And the majority of subsidy expenditures are claimed by these southern-owned for-profit retailers like Northwest Company. Okay? And in order to operate their own store, or to kind of go around the stores and try and work as a collective, establish a co-op, or order their own non-perishable goods, people living in northern communities have very limited option for purchasing freight. And in fact, one of the options for purchasing freights is to purchase it from the retailer, since Northwest Company owns one of the airlines that operates in the north. So not only are services concentrated in the north, they are closely integrated. And by that I mean, it's not just food security that's impacted by this transportation nexus or channel. That flight map of the Arctic is also the map for birthing services. So very few communities have midwifery services, and for the most part, people are evacuated to southern referral hospitals to give birth. And most referral care happens in this way. For example, there is no cancer care in Nunavut. All Nunavut cancer care that's acute or has to involve palliative care has to take place at a southern referral hospital, typically Edmonton, Winnipeg, Ottawa. So the flight maps are also the maps of social services, legal services, how housing construction happens, how a community accesses energy, fuel that it needs for transportation, but also for heating their homes and powering their communities. They're the evacuation rates for post-secondary education, and in the case of the northern provinces, for secondary education. Many of people's employment prospects, whether seasonal or permanent, occur through these lines. This is how people get their mail. In many instances, this is how people can do their banking. So there's an integration of all of these service domains very tightly. Okay. So our group is starting to examine this integration through a new collaboration in Northern Ontario, and we're working with communities in this sort of north central area, the community of KI or Big Trout Lake First Nation, Bearskin Lake, Cat Lake, Winneman, this lake that's just south of the proposed Ring of Fire development. And we just had a master's student in civil and mineral engineering, the brilliant emerging scholar Pia Dima-Yuga, do an analysis of how interconnected these various service domains are. And I'm looking forward to that paper coming out. That's pretty exciting. So what we've learned is that energy, transportation, health, and food security are really tightly integrated in these communities. So much so that transportation is in essence dependent on itself. And the way that comes about is that people have to fly fuel to communities in order that planes can refuel. Now, if that doesn't sound like a bit of a catch-22, you're not listening. So. Oh, and the other place where we're exploring this is with Mushkegowuk Tribal Council. So that's in the far northeast of this area. There are 4 communities that line up and that have been dependent in the past on an ice road that's been partially funded by the Victor Diamond Mine owned by De Beers. That's 90 kilometers west of Attawapiskat. Well, that mine's closing and being commissioned, and Mushkegowuk is taking over ownership of that winter road. And that will only work if they can become sort of a primary service provider for its own 4 communities. So we're gonna work with them as they move through that transition. So all of these sort of service and infrastructure interconnectedness are extremely vulnerable to climate. And we know from recent studies that air and marine infrastructure are vulnerable to coastal erosion, flooding, severe storms, changing winds, lightning strikes, and forest fires. And then there was a recent study by Yukari Horai at UTS that forecasted that climate impacts on winter roads are going to increase. And they published this wonderful work on models that predict really worsening conditions for these North Provincial and Territorial winter road networks, so much so that it may not be possible for those road networks to continue in their current form. And this would be a real tragedy because communities get their best cost fuel and food supplies by bringing them up on the winter road networks. It's much more costly to bring them up by air. But even in the far north, there are some winter roads, a few in Northwest Territories. You know, of course, Nunavut doesn't have any, but Northern Quebec, Northwest Territories, and Yukon rely on winter roads for quite a bit of their fuel and food provision. And so climate change is going to, you know, worsen their ability to do that. So I think I'll just conclude with a few recommendations. You know, we see that northern communities have really complex and interconnected networks of service provision, that health, retail food, and I want to say harvest. Most harvesting equipment is purchased in the local retail store. So while there is excitement about self-determination in the area of food sovereignty and food security, it's not unconnected with retail service provision. Those things work together. Okay, I see there's a question. I'll just maybe finish this summary slide and then address it, Arnush. Thank you. So what I see is needed is a realignment of transportation services and policy to suit a northern perspective. It's not like in the South where people have alternative options and can use different transportation options to solve a problem. In the North, everything is too concentrated and too interconnected to overcome some of those transportation barriers. The second thing I see is that the landscapes of service provision are really constrained by current federal policy structures. And if I use Nutrition North Canada, the subsidy as an example, it is impossible under the current subsidy framework for local First Nation run stores to become eligible for subsidy. They are simply told to order their supplies through an eligible, subsidy eligible Southern retailer or wholesaler. And that really privileges the for-profit Southern corporations and not the Indigenous-run, locally developed community industry or business. So we really like a reorientation of some of this governance and policy to reflect a decolonized system of service provision. So Indigenous-led and developed businesses and enterprises, they're the ones that would be eligible for federal support. Okay. And so to that end, you know, really develop these community-centered Indigenous-led services and supply chains and the policy structures that can make them sustainable in the long run. So those are my recommendations. Okay. All right. Thank you very much for your attention. And I see there's a question from Arnush. Chris, should I just go about answering that myself?
Sure. I mean, first I wanted to thank you for your great talk. I think that covered a lot of very interesting context in the North. And I do want to open it up for discussion. I think one of the challenges we're going to have because we're online is to actually have a full discussion. And so given that Arnush has a question typed, I think you can go ahead and answer that. And I would encourage other people to raise their hand. And I think I have the power to turn on your mic. And so we can actually get some discussion going on. And so after Arnush's question, I would like to encourage that. So go ahead, Tracy.
Thank you. I see the question from Arnush is, how do local stores get supplies? Is it from the South or their products are traditional food, maybe from other communities. So you see those transportation networks that I showed in the route maps are basically south to north. And that's a real challenge because there is great potential for food products, whether they're traditional harvested foods or foods maybe manufactured or grown in local communities, to move in a more horizontal way. There are policy barriers to that in terms of inspection and regulation. So we recently published a new paper looking at some of those policy barriers to horizontal food production and exchange in the North. And I can send that to anybody who's interested. It's published in the journal Arctic, and the lead author is Wilson. But yeah, I think that there is great potential for north to north trading and exchange and sale and use of both traditional and locally grown items.
Okay, I see a question from Michael Widener. So Michael, I think I've allowed you to talk.
Okay, can you hear me okay?
Yes.
Okay, thank you, Tracy. It's a really interesting talk, as always. I had a question about strategies around warehousing and storage. I was wondering if you could speak a little bit more about how these stores and non-perishable foods, because their ability to move foods sometimes by ship in different parts of the year. Do they have facilities to store large amounts of non-perishable stock, and then do they just try to fly in the perishable food? Maybe you could speak on that a bit.
Yeah, that's a good observation. Yeah, you're absolutely right. So it's the private southern-based retailers tend to have the larger warehouse facilities in communities, and we saw that in the city of Iqaluit with the North Mart store warehouse fire a couple of years ago. I don't know if you remember that. Got some pretty good news coverage, but they have a large warehouse that's attached to their store. And there was actually quite a bit of fear among community members when that warehouse fire occurred about the ability of the stores to keep the food supply to community members over that season. It turned out that while there was damage, it wasn't widespread, and so they were able to keep things on the shelves. The smaller communities and certainly the locally run stores have far more limited warehouse storage, and there has been an effort, there have been some regional efforts to develop some regional hubs with warehousing capacity. So the one I'm most familiar with is the Sioux Lookout Regional Food Distribution Hub in the community of Sioux Lookout, Northern Ontario. There are 29 remote First Nation communities that could be supplied out of that hub, but it's kind of stalled looking for investors. There was a limited amount of provincial investment, and Health Canada has actually partnered with them to have health supplies for the community nursing stations made available through that hub. I know of another regional hub in Northern Ontario at Timmins that's proposed by the Mushkegowuk Tribal Council. But largely these are kind of regional initiatives, and they're slow to develop and limited by funding. And what they are challenged by is that they have to compete with the tremendous supply chain advantage of these for-profit retailers that have been operating in the North for a long time, and now are becoming vertically integrated companies that own their own warehousing, shipping, and airlines. So that's going to be a tremendous challenge for northern communities.
So there's a question in the chat. I don't know if you can see it, Tracy.
The one from Lauren?
Yes.
When you talk more about community-led initiatives around food security. Oh, yeah. Yeah, so there are amazing community-led food security initiatives across Canada, and many of you may be aware of them. For an Inuit perspective on that, ITK's website hosts something called the Nuluak Mapping Project, which maps community food security initiatives across Inuit Nunangat, or the Inuit homeland. So from the Western all the way to the Eastern Arctic. So that's a good resource for that. Yeah, it is. I mean, they are smaller scale, and they tend to be not-for-profit or social enterprise initiatives, and they just don't get the same funding or media attention as the larger federal policy structures. So I'm sort of struggling to bring them to mind, but there's some very good work being done. Oh, I can mention the Aki Foods cooperative that's run out of Garden Hill in Manitoba, and they have a greenhouse enterprise and a poultry enterprise, and they're doing door-to-door roaming, lettuce delivery, and some very exciting stuff. And I think they're experimenting with horizontal distribution across remote communities in northern Manitoba, which is really exciting. And then you also asked me to talk about some provincial federal policy changes that I'm seeing that seem appropriate. Actually, the territories are leading us in terms of policy change. So one of the most persistent barriers to food sovereignty initiatives in the North comes in food inspection, in the areas of federal and provincial food inspection, limitations on selling harvested animals and fish. And so the territory of Northwest Territories has built a mobile abattoir, and it's up and running and visiting communities, and it has its own territorial inspection platform. And so that way communities can harvest and then sell, caribou and moose and other meat that's locally harvested. And this is incredibly important for traditional First Nation and Métis identities in Northwest Territories. And there is a similar initiative in Yukon Territory to develop this mobile abattoir. So we see those as really promising initiatives. And then as a provincial initiative, there's one I can highlight is the, I might have talked to some of you about this before, is the Nunavik Arctic Char program for pregnant or nursing mothers. So people living in the 15 Inuit communities in Nunavik have a partnership with Air Inuit, with an airline that serves their communities. And they pay harvesters to harvest Arctic char where it's fresh, which differs depending on the month, time of year. And then that fresh Arctic char is flown to communities that register pregnant or nursing women, and they have first dibs on this very high quality, highly nutritious food that's so culturally appropriate. So those are real highlights, real standouts.
So there's a question on the Q&A from James Gibb, and I think given the time that's going to have to be the last one. So if you can talk to that one, if you can see it.
On the Q&A, oh, here we go. Do you see any differences in household food security between homes with members participating in the fur trade versus houses who might not? So that is an interesting question. James is asking whether people who have a trapping, who practice fur harvesting or trapping may be more food insecure. I haven't seen any data on that. And I know, James, that's an interest of yours. But certainly we know that people do benefit from participating in traditional harvesting activities, whether they be fishing, trapping, or hunting, and that the nutrient profile of the harvested animals, this is not just more healthful because you're out on the land and being physically active. The nutrient profiles of the animals consumed and the fruits and berries consumed are irreplaceable in terms of Western diet. So we know that it's very healthful and very useful for people to be able to participate in traditional food harvest activities, but retail food is still a limitation of that. So the retail operations, are where people get many of their harvesting supplies. So bullets, gas, that's where you buy your four-wheelers and snowmobiles and boats. You buy them from the local store or through the local retailer. And so if we don't get a handle on the practices of those organizations and more self-determination for communities in terms of retail options in the communities. We continue to send dollars down south rather than let them benefit the communities.
Thanks, Tracy. I did say that was the last question, but there is one more in the chat. So for those of the people who can still stay around, I think we'll try to address that one from Armand. Do you see it?
I do. How do local stores communicate and order supplies? I'm interested to know how these stores, transportation services, and citizens communicate with each other based on existing IT infrastructure. Yeah, I can speak to that a bit from the Northern Ontario perspective. So I spoke with a group of First Nation counselors and people working for a First Nation run store. And they had tremendous barriers in terms of the systems available to them for their ordering and storage and sort of bookkeeping around their store. And so I think there's great potential for capacity development in that area. And you're right, all of the internet service in Northern Ontario is satellite based. I mean, it's decent given how remote you are from the south, but it's still pretty slow, pretty limited bandwidth. So yeah, that is a limitation on communities' ability to compete with a southern-based retail chain. And I think it's an area for, as I say, I think it's an area for innovation and problem solving that maybe engineering can contribute to.
All right. Well, thank you, Tracy. And I think that was a great way to start off this this seminar series. And I want to thank you for doing that and have a virtual clap. Thanks very much. And thanks for everybody who is coming, who has been here. And please sign up for not next week, which is Thanksgiving, but the week after, where we're going to have the next talk in the series. So thanks very much for coming.